cells are the DNA of hope for the ailments that have no cure till now. In the silent corridors of the mind, people are at work, cracking the puzzle of life by identifying a source of perennial hope for a healthy life, leading to stable existence. Since 2003, a team of doctors have embarked upon a task to research, manage and cure people by adopting the new age medical revolution, the use of stem cells in the field of regenerative medicine. And International Stem Cell Services Limited is the backbone of this team, effectively developing the knowledge base for regenerative medicine. This company is making rapid strides in this frontier research, proving the adage, success follows the brave.
International Stem Cell Services, our motto is and our mission is to provide the best quality service for the least cost, make it as cost effective as possible. The main thing is not to compromise on the quality. In terms of stem cell specific services, I believe we are at par or more, even better than the people in the US. What has happened is in the US, the focus has been so much on embryonic stem cells. People don't know much about what the adult stem cells can do. The adult tissue specific stem cells have a lot of potential, and we are one of the few companies who have actually garnered this into the clinical practice. When we started the company, the mindset was, how do we maximize the potential of these stem cells without inflating the costs? And so our technology is homegrown. Our technology, we have experts in our team who can not only work with the existing technology but improvise it, develop it and improve it to a point where we can use the technology and without making any extra costs for the patient.
International Stem Cell Services Limited is the only company in India that offers the whole range of stem cell related services, from banking to therapy. In therapy, the company is focused on delivering a wholesome solution to patients suffering from incurable diseases by using autologous adult stem cells in the treatment of these patients. International Stem Cell Services Limited has state-of-the-art facility including the C-arm at St. Teresa's Hospital, Bangalore and at Mumbai to carry out these procedures.
International Stem Cell Services provide us with the expertise of stem cell development from bone marrow, fat and umbilical cord wharton jelly. My primary research area is diabetes and its complications. Various kinds of neurodegenerative disorders, genetic and autoimmune diseases are also treated at our clinic. We employ autologous stem cells derived from bone marrow, fat and umbilical cord wharton jelly mesenchymal stem cells. I have started treating diabetes and its complications since the last 2.5 years. Patients with only diabetes or patients presenting with various complications of diabetes like polyneuropathy, chronic kidney disease and various kinds of heart and stroke ailments related to diabetes are treated with autologous bone marrow derived stem cell therapy. These patients have responded very well to the initial treatments what we have provided till date. Diabetes is the major cause of mortality and morbidity in our country, and hence treatment of diabetes with the stem cell therapy is of great essence so as to make our country free from diabetes.
Spinal cord injury has remained one of the most dismal injuries that one can suffer from, in spite of all the recent medical advancements in the last few decades. This is one injury where patients are usually left permanently disabled when the injury is severe. Spinal cord injuries can be treated by stem cells in various ways. One source could be the patient's own stem cells from his own body itself. This can come either from areas like the nose, or from the patient's bone marrow, or from certain cells in the skin. The methods that we have been following at our center, we are using patients' autologous cells, in the sense that means we are using patient's own cells from his own bone marrow, and therefore we are not manipulating these cells in any way. We are not culturing them or anything. So as a result, these cells are extremely safe, and they carry very low chance of any complications or side effects. Yeah, we had recently a very interesting case where a patient had suffered a spinal cord injury about 3 to 4 months back, and this patient came to us bedridden on a stretcher, and we offered him stem cell therapy. Because of the nature of his injury, we did not do it by direct implantation, but by injection into the spinal fluid. To my surprise and to my great amazement, this patient came back to us walking. So there is definitely potential and hope as far as spinal cord injury is concerned, as regarding stem cell therapy.
The term osteoarthritis. This means the cartilage which is covering the bone ends at the joints. This is covered by a structure called cartilage. So this cartilage is actually protecting. So this is acting like a shock absorber. So, and also helps for a smooth gliding movement between the joints, between the bones. So once this wears out with age and due to some injuries, then the defect causes wear and tear, enhancement. So then the people can have a severe pain, deformity and disability in a day-to-day life. So in these conditions, we are hoping that the stem cells will be of some kind of help. So this is what is about stem cells in osteoarthritis. Delivery, we are injecting into the joints itself. So for example, the cartilage is worn out there, and then we make some kind of a channels into the bone marrow which is inside the bone. So and then we inject the stem cell into the joint. So the mode of delivery is into the joint itself. It's not into the bloodstream and then from there it comes. So I can say at this point that moderate to severe arthritis may be a good option to select for this treatment. I am quite hopeful about this.
कौन सा ऑपरेशन किया? ये ऑपरेशन के पहले कैसा था, अभी कैसा है?
पहले से
बेहतर, मतलब ऑपरेशन हो गया आपको पता ही नहीं चलता. देखो
पता नहीं चलता.
ये बेंड करना, सीधा करना, ये बेंड करना, सीधा करना. वेरी गुड.
अच्छा है. ऊपर भी उठाने आता है.
बैठने.
तो ये 3 दिन का ट्रीटमेंट लिया, बाद में 10 दिन में इम्प्रूवमेंट शुरू हो गया और आपका जो क्रिएटिनिन यूरिया लेवल दोनों कम हो गया. उसके बाद में डायलिसिस बंद हो गया, यूरिन चालू हो गया. मोशन सब एपेटाइट वगैरह सब हो गया. बॉडी स्वेलिंग चला गया,
कम होते गए पूरा. अभी कम आपको कम होते
जा रहा है. तो इम्प्रूवमेंट है अभी आपको.
This patient had already undergone left leg amputation for his vulvar disease condition. Now he had slotted for the same amputation for his right leg because he had a very severe claudication pain with the pregangrenous stage, and this patient was not qualified for vascular reconstruction as well as angioplasty. Hence we had advised him about stem cell therapy, and after 3 to 6 months of treatment, he became normal. We have been very successful treating this condition, avoiding amputation, and he is back to his normal life, using his right leg for his earning his livelihood.
Banking with International Stem Cell Services Limited is a form of biological insurance that provides a sense of security for the donor as well as his or her family. The company has a state-of-the-art facility for storage and excellent systems and procedures in place for retrieval and processing. ISSL stem cell banking includes umbilical cord blood, bone marrow, peripheral mobilized blood, and fat.
This concept of cord blood banking, which is done in an autologous manner to treat certain diseases which are directly applicable for the child's life in future. For example, you can take his cord blood, his or her cord blood, and use it for a spinal cord injury which he may or may not be in that position later in life, and for that you have to make sure that these cells are actually going to become a neuronal cell when they are in that environment. So in the same respect, you can take these cells and treat a hepatic disorder or a kidney disorder or diabetes or diabetic foot ulcers which come with diabetes, or diabetic neuropathies, diabetic nephropathies, or even Parkinson's, Alzheimer's. So the procedures are fairly simple and standardized now. As a company, we have franchisees all over the country, and we are able to deliver the stem cells, collect it and deliver it to us within a span of 24 hours. So when the mother is interested or she wishes to bank, she can call up our representative or look up our web page, and during the time of delivery, basically the child, after the child is born, before the placenta is expelled, you collect the cord blood. Typically around 100 to 120 ml is the optimal amount collected. So we have sterile devices wherein the sample is collected and the cord is also collected. Both of it are transported back into our lab, our CGMP facility, and then the process of cord blood collection, the banking begins. And the first thing we will do is make sure that the infectious diseases screening is done. The patient or the client is cleared of all the infectious diseases. That is a mandatory SOP we have. Then the sample goes into the clean room, and once the CGMP facility is geared to do this kind of work, and the processing starts. After the processing is over, we enrich stem cells, and these stem cells are then banked in long-term storage devices, which is basically in liquid nitrogen vapors at -196 degrees, and they stay there till the patient requires. The ICMR themselves say that cord blood banking is permissible. So there is no problem in banking autologous. So if you bank autologous stem cells for the child, it's perfectly legal. And the mother, like I said, has the ultimate right for the child's cord blood stem cells till the child attains an age of 21 years. At the age of 21 years, the child is having his rights. He can exercise it in terms of using it for himself or donating it or keep it going for some more time. So we've had this interesting case where the mother of a child who is suffering from diabetes type 1 has another baby, and she has requested that we use the second baby's cord blood and the mesenchymal stem cells from the cord to be used for the treatment of the first child. So now this is a perfect amalgamation of banking and therapy. And when you have banking and therapy together, these situations arise which could be addressed effectively. I would always strive that the banking option given to the parent is as reasonable as possible, because we are talking about biological insurance here. So the insurance should be provided at a rate where it is feasible for the client, and it should not be a drag in his pocket, especially at the time when they are planning to have a baby and there are expenses which are inevitable at that time.
International Stem Cell Services Limited is the brainchild of Dr. S.G.A. Rao, a renowned scientist in stem cell biology and a pioneer in the field of regenerative medicine. He is the founder chairman of ISSL, and his vision has become a reality today of bringing this new age Medicare to the common man at a low cost using high-end technology.
Though we are a very small company, we have carried out the maximum number of clinical trials using the stem cells, and especially the autologous tissue-specific stem cells, which come from bone marrow or umbilical cord and umbilical cord blood, etc. And these trials have been conducted in collaboration with very eminent physicians. We are a very small number in India, but then we have contributed a lot. As a matter of fact, taking it to therapy, we are actually, I can say that we are the pioneers. We are the few people who have done it. So this is very, very satisfying to know that even, like normally India we feel that we are always behind, but we are not behind in this.
International Stem Cell Services Limited is the only company in India to have 2 CGMP facilities to provide stem cell banking and therapy for patients from all over India. The Mumbai facility helps people of the north and western regions of India, and the Bangalore facility helps patients from the southern and eastern regions of the country.